Welcome back to the show, everyone. Kim Solomon joins us today. She is with Compassionate Care Hospice, and along with Angela Manuel with Brookdale Senior Living. Ladies, thanks so much for coming in. You're here to invite seniors to a very special event.
Yes, we are, Francis. We're having another free lunch and learn for the public. We're going to be doing a heart health talk on this Thursday, February the 11th, from 12 to 1 at Brookdale Senior Living Facility, which Angela's with.
Okay, you two partnered to host it at Brookdale. Tell us why.
We wanted to get out to the public, not only for our residents, but also the local community on how to prevent and also how to live with heart disease.
Okay. And I know part of Compassionate Care Hospice, you have something called Cardiac Connections. What is that program?
We have a program called Cardiac Connections, like you said, within Compassionate Care Hospice, and that program is specific to patients with end-stage CHF or congestive heart failure. So we do a real good job of keep those patients at home or in a facility and out of the hospital.
Right.
A really good job. We have less than 1% readmission rate back to the hospital with our program, and we're really proud of that.
And then I know, Angela, you see this on a day-to-day basis because it is a senior living facility, and there are folks that are doing quite well, although they have this diagnosis.
It's good to have a program such as the Cardiac Connections with Compassionate Care to be able to come in and offer that extra support for our residents.
Right. So what sort of support is it? Obviously,
with Cardiac Connections, we have a full-time nurse practitioner, which is Christine Goudros, who's our cardiac nurse practitioner. She's going to be actually doing our talk for us on Thursday. Okay. And she can go in and monitor those patients and adjust medications accordingly. With congestive heart patients, they get filled up with fluid, and then they have to go back to the hospital to get that fluid drained off because they can't breathe. So we do a real good job of monitoring that. We have a nurse that calls them 7 days a week to see how they're doing,
that
anxiety, weight gain, chest pain, things like that.
Right.
And then if they complain of any of those things, that we can send someone out to look at them. But they also have an aide that's looking at them 5 days a week and a nurse that goes twice a week. So a lot of hands-on, eyes on those patients to really take care of them and monitor them closely.
Because these people want to be at home. They want to live their life at home. And certainly trips in and out of the hospital can be very anxious and very difficult for families.
And it's hard on the patient to get to the ER.
Right.
So it takes a lot out of them to even go.
Right.
So we try to prevent that. And that's what Christine will be talking about on Thursday.
Okay.
So she'll be able to
describe the Cardiac Connections.
Oh, she's going to talk a little bit about that, but she's going to talk about how we can keep them from getting to that point, or at least expanding and, have a longer quality of life. So she'll be talking about things like not smoking, not drinking, keeping your goals realistic when you make goals.
Exercise.
Right, you may not be able to walk to the end of the street, but you may be able to walk to the mailbox, just down your driveway. So any little bit will help.
Good, wonderful. So the public is invited to this event. Again, tell us when, where, what time.
It is Thursday, February the 11th from 12 to 1 at Brookdale Senior Living, and the address is 351 Windermere Boulevard. That's behind Louisiana Iron Laser.
And lunch will be provided.
Wonderful. And Angela, I'd clarify Brookdale Senior Living because I know it as a couple of other names, so it might be a little confusing for people.
Yes, a lot of us, a lot of the community may remember us as Kingsley Place.
Right.
But we are same employees. We were there when it was Kingsley Place. We've been through some name changes, but we are now Brookdale Senior Living. Okay. It's a good company, and we're enjoying that, and they take care of our residents and allow us to do that as well.
Wonderful. Ladies, thanks so much for joining. Great information for the community. We appreciate it.
Thank you, Francis.
Stay with us. More Good Day Cenla coming up.